This amendment actually removes all of the arbitrary caps on THC content in cannabis product. Look, we've seen this amendment in a previous committee, but I wanted to give it a second chance. Let me explain it. We're removing the 10% THC cap on flower. We're removing the other caps on other forms of administration. But what we're also doing is we are creating an OPAGA study. The OPAGA study basically says that they will research the use of high concentrate THC, including any adverse patient outcomes recorded as a result of the use of THC. Reminder members, we have 500,000 patients in Florida's legal medical cannabis program. It's the largest in the country, so I'm sure we can find out about any adverse responses to high potency THC through the study. And also the third part about this bill is we actually are inserting a limitation on the daily dose, but what we're doing is we're putting in the limitation on the daily dose that was recommended by the statewide board, which just simply, unfortunately, hasn't been implemented because the Office of Medical Marijuana has been busy, I suppose. That limit is 54,250 milligrams of THC as the limit. Of course, that's for a 35-day supply. So we are putting in the THC limitation on daily dose that is recommended by the doctor the doctor board, the statewide doctor board, as opposed to an arbitrary limitation set by politicians. That's the amendment Representative Roach is putting forward and why we're trying to remove it. The very first bill that was signed into law by Governor DeSantis was a bill that added cannabis flower to the list of available products and that allowed smokeable flower to be a part of our legal medical cannabis program. Think about that. Such a priority for Governor DeSantis, which I agree with. We arbitrarily restricted flower when we first enacted the will of the voters and created the implementing law for this program. The first bill he signed into law as governor brought flower and smokable product into the program. This bill reverses that law. It doesn't very clearly state it. It doesn't say we're going to prohibit flower. You won't find the text anywhere in there. But what you will find is the text in the staff analysis on page 6, which tells you what the potency range is for flower. It says it ranges on the low side from 10% to the high side of 28%. So what are we saying here? We're capping THC potency for flower at the lowest possible scientific range that it can be produced in the state. That's if we're lucky. So really what we're doing is we're banning flower. We're banning flower. It will be pulled from the shelves. We will reverse the work of the very, very first bill that Governor DeSantis signed into law. People are probably wondering, oh, but it's all genetically modified. Can't they just create and breed a new plant that has lower concentrations of THC? No. Cannabis is like wine. Cannabis is like a grape. Sure, we hear about other strains and other plants from other states and other countries. That's not how this works, members. Our cannabis growers in Florida who are in the legal industry are not allowed to import product from other states. They must grow it here. They must grow it under our climate conditions. They must grow it within the borders of this state. And if you've met with any of our growers, they will tell you, we cannot produce flower at 10% or less as required under this bill. So we're banning flower. And what is the justification for banning flower? The justification is that we have no known adverse reactions to the cannabis plant, specifically to high potency THC in the state of Florida. In the last committee, we heard, well, don't we remember the opioid crisis? Don't you all remember? We don't want a sequel. This is not a sequel. Cannabis use, high potency THC, is for sick patients who need it. But the only exception in this bill, which is what I'm trying to remove in this amendment, the only exception we've allowed for adults to access high potency THC, which is the cannabis they need, let's be real, that's what they need. The only exception is if you're terminal. So you have to wait for the doctor to tell you you're dying. For us to say, fine, you're allowed to have high potency THC cannabis. So we're telling them, so with this bill, unless we pass this amendment, we, the politicians, the members of this committee, we are inserting ourselves in between the doctor and the patient, and we are saying, we don't care what the doctor says you should have. We are stepping in and we are capping and restricting your ability to access this medicine. And for what? What's the justification? Show me the justification. Show me the deaths. There are none. Show me the overdoses. There are zero. Show me the recorded adverse reactions to high potency THC, which, by the way, is required during your second certification visit. When you go back to your second doctor, they are required by law to record and ask you about any adverse reactions that you have had. This is not a small group of people giving us this information. It's 500,000 Floridians who are in the legal program. And they have not told us that they're having problems. None of those problems have been recorded. But this bill comes along and says, well, we're going to take it away anyway. Members, this does not make any sense. No one wants this. How many emails did you get from people in your district saying, please cap THC, we must do this? You didn't get any. There's no point. There's no point to any of this. Please vote for this amendment. Thank you, Mr. Chair. So I want to start by thanking our colleague, Representative and Dr. Ralph Masulo, because the amendment, actually the text of this amendment allowing for reciprocity in the state for medical cannabis patients is identical to a bill that he filed in his first term to try to improve the medical cannabis program. So, this was certainly his idea. It's a revenue generator, members, but the point here is that this bill, Representative Roach's bill, is an important opportunity for us to improve the medical cannabis program. So we're 4 or 5 years into this program now, and unfortunately, I have to admit that Representative Roach's bill is the only vehicle this session, the only vehicle for us to make improvements to this program. Now, unfortunately, I think that the product of the underlying bill is a wrecking ball to the program. So we're trying to make tiny improvements that we can get behind. But just to help you understand how much of an outlier we are here in Florida, how much work we still have to do to actually improve our program compared to other states, I want to let you know what other states currently offer the reciprocity that I am trying to add to the law with this amendment. Right now, The following states honor out-of-state medical marijuana cards: Alaska, Arizona, Arkansas, California, Colorado, Hawaii, Maine, Massachusetts, Michigan, Nevada, New Hampshire, Oklahoma, Oregon, Pennsylvania, Rhode Island, Washington State, and the District of Columbia. Why are we not in this group? We have the largest medical cannabis program in the country. Why is Florida's name not listed? I'll actually tell you for real why it's not listed. It's because every session we come back here, and instead of making a legitimate effort to help sick patients and improve this program, we're dealing with bills like this instead. That is why we're not on here, because we're not doing real work to fix this program. Let's start right here. Let's do this. I heard no debate against this amendment. What's wrong with it? Someone tell me. It's unfriendly, but no one has explained why. Why is this unfriendly? This is a very controversial bill, members. Where is the discussion? I'm happy to be under fire right now with hostile questions. Ask me. Why does no one support this amendment? It's a good amendment. It helps people. I don't understand. Please vote for this amendment. Thank you.
Having closed on the amendment, all those in favor of the adoption of the amendment signify by saying yay. Yay. All those opposed, no. No. By your vote, I see more than two hands. With that, Sabrina, please call the roll on the amendment.
Chair Avila?
No.
Vice Chair Yarborough?
No.
Representatives Altman?
No.
Barnaby?
No.
Ranking Member Brown?
Yes.
Driscoll?
Yes.
Duran?
Yes.
Harding?
No.
Robinson?
No.
Salzman?
No.
Saroy?
No.
Skidmore?
Yes.
Smith?
Yes.
Snyder?
No.
Trabuzzi?
Yes.
6 yeas and 9 nays.
Thank you, Sabrina. Members, by your vote, please show the amendment fails. Members, questions? Now in questions, Representative Saroy, you're recognized for a question.
Thank you, Mr. Chairman. Could the bill sponsor tell us, is this amendment friendly?
Not friendly.
Representative Roach, you're recognized.
Sorry, Mr. Chairman. This is not a friendly amendment.
Members, questions? Representative Guillermo Smith, you are recognized.
With permission of the chair, I'm hoping to ask the sponsor to explain why the amendment is unfriendly. Thank you.
Representative Roach, you are recognized.
Mr. Chairman, thank you for the question, and thank you, Representative Driscoll, for the amendment. So when we put the medical marijuana program in place and we set up in law a $75 annual renewal, I think we need to do a little bit more research before we adopt an amendment doing away with that revenue stream about what that money is being used to fund. And furthermore, I would tell you that previous iterations of this bill have included amendments or provisions in that bill to actually do away with the fee for certain for veterans, and that there are a number of people on this committee that voted that amendment down. So I'm concerned that if we add this amendment to the bill, it will change what we're trying to do here and may ultimately result in the failure of this bill. So at this time, I think we need to do a little bit more research about what that $75 annual fee is used to fund and what would be the repercussions if that funding source went away, and make sure there's widespread support for it before we adopt it. And that's why I would encourage you to vote down on the amendment.
I want to clarify further exactly what our caregivers are going through and why I support this amendment, what our patients are going through. This is less about administrative burden. The purpose of this amendment is not to get rid of government paperwork and make it easier for people to renew their card or to eliminate the card. the purpose of this amendment is to reduce fees. So to Representative Salzman's point, respectfully, when they go to renew their card after a year, yes, I will acknowledge it's easy to renew the card, but you still have to pay another $75 every single year. Easy or not easy, you still have to pay up. And we heard from Ms. James when she said that, that's $38 million in fees, taxes. I know we've had a debate in this body about whether fees are taxes. Let's just say the fees are taxes. Taxes on sick patients. I think it's very important to point out that Representative Driscoll, with her amendment, is extending the length of the medical cannabis ID card for patients from 1 year to 6 years. Why is that? Why did she pick 6 years? Oh, that's because we have a constitutional right to medical cannabis if you have a qualifying medical condition. Well, what does the constitutional right have anything to do with it? Well, because we have this thing in Florida called a concealed carry permit, which is a permit you apply for once and you renew every 6 years. And that one-time fee that you pay is valid for 6 years. Well, we have a constitutional right to carry a firearm, so that's important. Well, yes, but I have to remind members that in Florida, if you have an underlying medical condition, you have a constitutional right to access this medication. This is not just some random bill that we're changing statute. We are restricting people's constitutional rights to use the medicine. And just to remind you, because cost is an important part of this conversation, that's why Rep. Driscoll brought forward her amendment saying $75 for your ID card no longer gets you the ID card for just 1 year, but it gets it for 6 years. Let's think about who is going to benefit from this. Well, the list of eligible medical conditions under the state constitution: patients with cancer, epilepsy, glaucoma, positive status for HIV, acquired immune deficiency syndrome, PTSD, lateral sclerosis, Crohn's disease, Parkinson's disease, multiple sclerosis. Members, does that group of vulnerable individuals sound like people who are able to easily afford $75 for an ID card for themselves and their caretaker every single year? Many of these patients are Medicaid patients. They are living on a fixed income. And in addition to this $75 fee, which Representative Driscoll is trying to spread out over 6 years instead of 1, in addition to that fee, they are paying cash for the medicine because it's federally illegal and their insurance company won't pay for it. They are paying cash to visit their doctor because it's federally illegal and their insurance won't pay for their doctor's visit to get the initial recommendation or the follow-up. They are paying cash, 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 cash. This is why we see so many people enter the program, pay the $75 for their ID, and they don't renew. Why are they paying for their ID for 1 year and then suddenly dropping off? It's because they've got this figured out. It's because they realized, you know what? This program is really expensive. What am I getting by becoming a legal patient? Why don't I just go back to the illicit market? Why don't I just go back there? I can still get product. I don't have to worry about THC caps and all this other nonsense, all of these other fees. Members, we're trying to fix this. Please support Representative Driscoll's amendment. Thank you. Members, the reason I'm so passionate in opposition to this bill is this bill takes a wrecking ball to our medical cannabis legal program. I'm not trying to be overly dramatic. That's what it does. Let me connect the dots for you. If we're capping flower at 10%, we're banning flower. That's what we're doing. We're banning what Governor DeSantis signed into law as the first bill that he passed as governor. Now, how does banning flower impact this program? Well, inhalation is the supermajority of certifications for patients in this state's program. If we are banning THC at 10% or capping it at 10%, we're banning flower. If we're banning flower, which represents a supermajority of the certifications for patients in this state, we are severely restricting and cracking down on their access to this medicine with no justification, none. So, and I also want to point out one last thing, which is that previously in the last committee, we had Republican members of the committee who asked for changes. They asked for new language. They asked for amendments. We have no amendments on this bill. Where are the changes? Vote down on this very bad bill.